We are just starting off one of yet another hair transplantation case. We do a whole lot of hair transplantation in our practice. And so there's this wonderful gentleman who comes to us here from Pittsburgh. And I think he said you found us on the internet or talking
the internet.
There you go.
Right.
You'll see on these videos sometimes we do lots of sort of niche areas of hair transplantation like beard, eyebrow, things like that. But this is a pretty standard case, right? So tell us in your own words, what are you trying to achieve here?
Bring the hairline down here a little bit further, just get this area filled in a little bit.
Right. So this is pretty classic, male pattern baldness. So you can see here this frontal forelock and then this temporal area, but then also up here onto the top of the head, the vertex, and back here towards the crown. And so yes, that's what we intend to do today. And as we've discussed before, we use follicular unit extraction. There's no incision on the back in terms of a long linear scar. We take the hairs out one at a time, and our expert team of techs and myself will place this onto the scalp. So we're enjoying it. We're getting ready for the case. We're enjoying it. We will enjoy it and have a wonderful Wednesday.